In mandated coverage, each individual would be required to get health insurance, with those in lower income brackets getting assistance from the state or federal governments to pay the premiums. Under all proposals, insurance companies would be required to accept anyone who applies. And in some proposals, a federal insurance program would be created as an alternative to private insurance. In universal coverage, those not already covered by either private or company-provided insurance would be covered by a plan similar to Medicare. Coverage of the uninsured is a moral issue. Is society obligated to provide coverage to the less fortunate? Is health care, like basic education, for example, something we mandate every child should receive? Are we obligated to underwrite health care costs for the uninsured regardless of lifestyle choices, i.e. smoking, obesity, lack of exercise, hypertension, or HIV? The country apparently feels we have an obligation to provide health care coverage to children, veterans, and the aged. S-CHIP, with strong bipartisan support, was passed in 1993 and went into effect in 1997. Its expansion to include 4 million more children is currently being debated. This is a very popular federally funded program with proposed expansion underwritten by taxes on tobacco. It is administered by the states, generally through private health insurance plans, to needy children. The only sticky issue is who is qualified to get this coverage, a debate that's going on today between President and Congress. Likewise, the Veterans Administration provides full coverage, including dedicated doctors and hospitals for our military veterans, supported by our tax dollars. This is viewed by most as a very outstanding program, despite the recent problems that were experienced in Walter Reed Hospital. Many, though, are unable to get treatment because the present funding is insufficient. And this principally applies to veterans who do not have either injuries or disabilities from prior service or the extremely poor. And then there's Medicare for the aged, and funded mostly by a tax on wages of working people. But these funds are soon expected not to beat projected baby boomer payouts. I can personally attest, and probably the only speaker here today that can, to the fact that Medicare works much better than I have ever anticipated. And finally, there is Medicaid, the largest source of funding for medical and health-related services for America's poorest people. This is a jointly funded program by the federal and state governments to assist states in furnishing medical assistance to eligible needy persons, generally those with income below the poverty level. Although the federal government established general guidelines for the program, the Medicaid program requirements are actually established by each state. This program suffers badly from bureaucracy and a lack of funding. Reimbursement rates are extremely low, and payments to providers are often delayed for months, resulting in many primary care providers refusing to accept Medicaid patients. So the nation does feel an obligation to provide insurance coverage to certain groups of individuals. The question is, do we have a moral obligation to provide coverage for the remaining uninsured as well? Let's now transition to how do we pay for health care for all. In a recent Gallup poll, results showed that about 80% of Americans have health insurance. The good news was that most people with coverage are highly satisfied with the quality of care they receive, with the access they have to their system and their own doctors. But the study also found that most were concerned about the complexity of the system and worries about rising costs, making this issue one of America's chief concerns. A recent Commonwealth Fund survey of 12,000 Americans reflected the impact rising costs are having on health care. 37% responded that in the past year they had chosen not to visit a doctor when sick skipped a recommended test or treatment, or failed to fill a prescription because of cost. Today, businesses provide health coverage to 60% of the total population, or more than 175 million people, with the number dropping annually. This represents nearly 90% of those covered by private insurance. This practice began during World War II when wages were frozen and companies were desperately seeking new workers. Companies competed for workers by offering the untaxed benefit of health care. Over the years, companies, particularly those represented by the larger unions, have steadily increased the amount of benefits provided to employees. Other companies have been forced to follow suit to secure and retain employees. As healthcare costs have escalated by more than 10% per annum, many of these smaller companies have reduced or eliminated healthcare coverage as insurance premiums have soared. Businesses are struggling to retain their competitiveness against competitors, domestic and foreign, that do not provide healthcare coverage. Most recent example of this is the automotive industry, where GM and other car manufacturers soon to follow has shifted its legacy healthcare cost to trust administered by the UAW. GM claims its healthcare cost puts it at a $5 billion disadvantage versus Toyota. And it's not just in smokestack America. Starbucks now spends more money on healthcare than on coffee. The GM-UAW contract is an example of a trend sweeping the nation. Employers are abandoning their role as the chief healthcare buyers, particularly for their retirees. Americans who have company-provided insurance are very satisfied with it, despite increased premiums, co-pays, and deductibles. This shouldn't be surprising, given that company premiums are only 20 to 30% of what employees might pay for comparable coverage through private insurance. Yet companies really don't want to be in the healthcare business, but find the other options unattractive. Currently, their expenses are tax deductible. And in a new plan, this could change, and/or their burden being increased by taxes to support the cost of covering others. The devil they know is better than the devil they don't. Bottom line, business is not going to be anxious to accept additional taxes to pay for the uninsured. So what are some of the alternatives for health care for all? First, a ballpark estimate of what this might cost. Estimates range from $50 billion to $200 billion per year.